Hey, what's going on? It's Marlon Conaway, aka Marlon the Money Coach, your trusted agent for all things insurance, real estate, and investment advisory, man. Coming to you today with the Medicare Minute, man. We hadn't talked to you guys for the last few months. Hope and pray that you guys been safe and enjoyed your summer time months. And now we're rolling into the fall coming up. And you know what the fall brings? Medicare enrollment season, okay? And so right now in the month of August and starting in probably September, you'll start gearing up with more commercials, more phone calls, more mailings to your home in reference to Medicare enrollment, okay? And so I want to talk today on today's Medicare Minute, the two biggest questions I get from most of my Medicare clients. The first question I normally get is, man, what's going on with these commercials with Broadway Joe and Mr. Dynamite, right? Jimmy JJ Walker. These commercials, man, are all over the place. And I get at least 2 or 3 calls a week asking about these commercials and, hey, what are these benefits they're talking about? Okay. These commercials are geared around the programs that you currently already have. If you're on a Medicare Advantage plan, a Medicare HMO Advantage plan, or a Medicare PPO Advantage plan, those are the two most popular Advantage plans in our area, then you already have what Mr. Joe Namath and Mr. Jimmy JJ Walker are speaking of, okay? And so when you hear the commercial talking about, you get free preventative dental coverage, vision, rise to your doctor's gym membership, right? They're talking about Medicare Advantage health plans. And so if you have any questions about what benefits your particular plan covers, or if there's any particular programs that may give you more richer benefits, man, always reach out to me. When you call that 800 number from the commercial, it goes out to several agents in your area. Okay. So it prompts, man, 10, 15, 20 agents calling your house, trying to get you to switch plans, et cetera. So, man, give me a call. We can help you with any question you may have. But that's what those commercials are pretty much marketing and pitching. There are a ton of people out there in the Medicare world that do not have any type of health insurance plan other than original Medicare. And so those programs, those commercials are really targeting those individuals. So if you already have a Medicare HMO, Medicare Advantage HMO, or Medicare Advantage PPO, you pretty much already have the type of programs that they're speaking of. Now, you may also hear them mention something about not having to pay your Medicare Part B premium, all right? And so to qualify for that, if you contact your local Department of Children and Families, or actually you can also contact your healthcare provider, whether you're Humana, United Healthcare, Aetna, Care Plus, they all have a social services department, okay? And there's a particular level of Medicaid called a Medicare Savings Program. Okay, you have to qualify based on income and assets. But the Medicare Savings Program, if you qualify for that program, it will cover your Part B premiums. Okay, you don't have to pay that $148 or whatever it is now. I know it changes every year. You don't have to pay that out of your Social Security. Okay, so that's a level of Medicaid that allows you to not pay that. Now, some Medicare Advantage health plans, HMOs, Medicare Advantage HMO programs, also have what they call a give back plan. Sometimes you may hear them talking about getting money back. Okay, so there are plans in your areas that offer a give back, which covers a partial give back of what you pay out to Medicare Part B premium. So some of them are $70 or $100 or something like that. Okay, and so if you're curious about those, reach out to me as well. Because anytime somebody's giving you something, they're taking something away. Anytime they give you something, they're going to take something back in other areas. So if they're giving you back, just say example, $75 a month, okay? Sometimes what may happen is it could alter your copays for your primary care physician, your specialist, your hospital copays, your emergency room copays. It can also take away benefits. Maybe you may get the $75 back, but you no longer have the rides to the doctors, right? Or you no longer have your gym membership. Okay, so we can explore the possibility if you think that one of those programs may be beneficial to you. Okay, we can kind of do a side-by-side comparison of what you currently have and versus if the give back program may be a best interest to you. Now, a lot of times, if I have a person that's on VA, they go to the VA hospital or VA doctors like 100% of the time. Those give back programs are very great for those particular individuals. Why? Because they don't really use their Humana or United Healthcare or Care Plus or whatever plan that they may have. They don't use it at all, really, okay, because they go to the VA 100%. And so if they got a give back program that gave them $100 back every month towards their Medicare Part B, and in return, it raised their primary care physician copay, their specialist copay, they don't go to see those doctors on their current plan anyway. They go to the VA. So in essence, for those individuals, it may make sense. But if you have a question or you're curious just to see, man, reach out to us. We can help you there. So that's question number one. Joe Namath and Jimmy J.J. Walker commercials. Hopefully we summarize that a little bit as far as what those commercials are targeting. And just keep in mind, if you have any questions, right, step number one is to call Marlon. Step number two, call Marlon. Step three, call Marlon. Does it make sense? Okay. If you have any question about anything, okay, because when you call those 800 numbers, man, you're going to have a ton of agents reaching out to you, trying to switch your plan. A lot of times they don't do due diligence to check your doctors to see if, the plans that they have are in network. They're just trying to make a sale. So make sure you're very careful on that. Just reach out to me. We've been doing a great job over the years, taking care of you, and we'll make sure that you're taken care of moving forward in the future. Next question number two. Marlon, is now the time to sell my home, right? A lot of you guys know or may not know, I've been a licensed realtor for about 6 years. A lot of you guys met me initially when I started with Humana back in 2011. Shortly after that, probably about 2 or 3 years after starting with Humana Insurance, we got our real estate license. And then from there, we kind of ended up leaving corporate and basically went independent where we can represent multiple companies, okay? So like right now, we got the Humana, the Care Plus, United Healthcare, Aetna, and some other companies that we represent on the Medicare health insurance programs, okay? But a lot of you guys know I'm a real estate agent, so they call and say, hey, it's not a time to sell my home. Not really sure. What I can tell you right now is the real estate market is high, okay? And anytime you're investing in markets, whether it's real estate or the stock market, the goal is to buy low and to sell what? High, okay? So the market is high right now, all right? But right now, you guys are probably already getting a bunch of phone calls from real estate investors. We buy houses, people trying to buy your house from you. And so if you are trying to decide if now is the time, man, reach out to me. We can sit down and discuss to see if it's the right time and opportunity, because real estate investors, their goal is to purchase your home for you for the least out of pocket. Okay, they want to get all the equities they can out of you, right? They want to buy your house for the least possible value. And using a licensed agent, their job is to try to help you sell your home for the highest and best possible value, right? We want to sell it for the highest and best offer, so you walk away from the closing table with more money in your pocket, okay? And so some of the questions that we can answer for you if you call us to find out is, hey, how much can I receive for selling my home? We want to find out the value of the home. Also we look at, hey, what should I do with the proceeds, right? Should I bank it? If I sell my home and I get $100,000 profit, right, for selling my home, where should I put the money, right? Some folks decide just to put it in the bank. Some decide to put it in an immediate annuity where they can start drawing income off of it. And that may be a great strategy to raise your bring home income, right? Your Social Security and your pension. Now you got some income from the proceeds of your annuity, and annuity is like setting up your own private pension, okay? And so $100,000 annuity could easily be an extra $1,000, $1,500 over the next 10 years as far as extra income payments coming into your bank account, okay? So those are some options. Where would I go is another question, right? Should I get an apartment once I sell my home? Because houses are selling pretty quick right now. Most homes right now are staying on the market maybe 30 to 45 days max, and they're out of there. They usually have a contract on it within the first week or two in today's market. Maybe worst case scenario, 30 days, but I mean, they're moving pretty quickly. So you want to have an exit strategy. Where are you going to go, right? Will you move into an apartment temporarily or long term? Will you go into the senior housing community? Would you go live with your family members, right? Or downsize to a smaller home? Because a lot of seniors, right, they're still living in the home that they raised their family, right? The kids have moved on, they're still living in a big, 4-bedroom, 2-bathroom home or 3-2 home, and the house is too big, the upkeep is too much. And so they're thinking about selling their home. So if that is a question on your mind right there, give me a call. We can help answer those questions as well. But man, that's today's Medicare Minute. We hope you got some value out of today's talk. Keep in mind, be watching, your mailbox, the commercials, all those different things over the next month or so. We're going right into Medicare enrollment season. October 15th is when you'll be able to start enrolling to new plans up until December 7th, okay? And we'll always continue like we have in the past to make sure that you're on the best possible plan based on your healthcare team, your doctors, okay, based on the benefits and resources and services that you need, and also what you have to pay out of pocket. We'll make sure that we put you in the best program. So once the time comes, man, reach out to us. We'll make sure we're still doing everything virtually right now. And so we've been using Zoom. It's been working phenomenally for us and our clients to make sure that everybody is safe, that we can facilitate business and not have to worry about transmitting COVID-19 to one another, okay? And so if you have any challenges as far as with Zoom. We'll make sure that we get you up to snuff on Zoom before your scheduled appointments. Maybe you have a younger family members in your home. These children, man, they understand technology, and they'll be able to help you out as well. So if you have any grandbabies or your children that's in there, 30s, 40-year-old, they can help you as well. So we'll make it work. But we look forward to talking to you guys soon. This is today's Medicare Minute. Marlon the Money Coach out.